channel Ask Your Gynecologist. I'm Dr. Sonal Parihar. As usual, I've come back with the third part of the series that I started, How to Conceive. So this is part 3. In between, I took a break. I uploaded another video. Just last time what you saw was a very intimate, a very sensitive topic on which patients or many people do comment, but they are not very open with me, with anyone in fact, that why the private parts of ladies and men as well, the groin area, the axillary area, under the breast, sometimes nape of the neck, that particular area, why is it dark, right? So I hope you enjoyed the video because it is actually the fact why it is dark. I've told you all the reasons. And the gel, the cream that I was actually holding in my hand, it is a wonderful thing. I have tried it on my patients. It is something new, and if you really want to try it, you can just click on the links that I have given, the Nykaa link and the Amazon link. You can easily order from there, and it is a very affordable cream and the results are very good. Right? So coming back to the third part of this series, How to Conceive. Before I start with this, I would just like to thank you all for the excellent response, the enormous response that you're giving to my channel. It is really growing very well, and I really enjoy chatting with you all. The new channel that I have started, you must be knowing now. Now it's been almost 10 days. Dr. Sonal's Answers. I go live on this channel. I do not do live on Ask Your Gynecologist. Right? So people who want to consult me, DocWise app is doing very well. It has started in the countries outside India as well. The payment option is always there. The technical number is there. You can always call or WhatsApp them. My PIN is there. You can easily connect. You can send your reports like WhatsApp, and you can get a prescription from me. Then if you want to come and personally contact me, personally see me in my hospital, this is my address. I always give you the address, my secretary's number. You can take an appointment. And if at all you want to ask me some question on my other portals apart from YouTube, then it's the Facebook portals I'm giving you, the pages, Instagram, Twitter, so that your questions don't get lost. Right? So coming back to the topic, How to Conceive Part 3. Now in the previous videos we discussed the basic things, that how to keep your body fit, what all myths are there in the society, that when to have sex, whether to get up or wash yourself after sex, what is the ovulation time in general, then what are the intercourse problems, the frigidity in women, the erectile problems in men, the ejaculation problems in men. We will discuss them all, right? So today we are going to discuss the third part. The next step where the problem occurs is ovulation. So if the lady is not ovulating, the egg is not getting released and the fallopian tube is not catching it, then how will the lady conceive? Now, ovulation problems can be broadly classified into two. One is the ovulation is not happening. Either it is getting trapped in the ovary or the ovum is not getting produced. The follicle is not getting produced. Second thing is the egg is getting released. It is optimum size, but the quality is not good. So the poor egg quality. Coming to the second one first. Poor egg quality. Poor egg quality is something which we cannot detect. We just can assume. Either you are having multiple abortions and we think that probably the quality of egg is not good. Why does this happen? We don't know. Generally, maybe if you are suffering from some genetic disease, from say SLE, autoimmune diseases, or chronic diabetes, chronic hypertension, you're just not well, you're just not fit. There is something which is affecting your hormones, your ovary. That is the reason why you're not producing a good quality egg. Right? Either it can be some genetic disorder, it might be an abnormal egg. In that case, you will develop an abnormal baby. And this is generally conducted, these tests are generally conducted by geneticians, the doctors who are interested in genetics. And generally such patients have a bad history of multiple miscarriages or abnormal babies, and for such patients we do not have much of a treatment. We can just suggest a healthy lifestyle. We can suggest you that you should always cure all your diseases. Not exactly cure, I would say control all your diseases like thyroid or diabetes. Everything should be controlled before you plan a pregnancy, so that the quality of egg that you release is good, so that your baby is healthy. And the third thing that we can offer you is a donor egg. A donor egg, if at all you want to go for IVF and your doctor is saying that you really need a donor egg because your eggs are not really of a good quality. And that too, the doctor has to first look at the history and sometimes examine the eggs if they are going for IVF. Right? So that is egg quality. Generally, the egg quality, it is said, deteriorates with age. Like in a lady, it is said, in a woman, it is said that after 35, the quality of egg is not as good as compared to a lady who is 20 to 30 years of age. That is the proper reproductive age group. That is because in women, the eggs, they mature fast. In men, the sperm quality does not decrease. If they are healthy males, then generally the quality is maintained till the age of 60. But in women, after 35, it becomes kind of an oldish or poor quality egg. That is why we always advise that in this current situation, the current world, when the marriages are getting delayed, people are trying to delay their pregnancy, please do not do that. If you are getting married at a later age, then you should complete your family as soon as possible rather than delaying it till 40, 45, right? Coming to the first reason, that is ovulation problem. Now this is the most common problem being asked to me either through messages or on the live session or on the DocWise app, because that is the main reason why patients cannot conceive. 60% of the problems of infertility are because of ovulation. Now, because I've already discussed this in previous videos, do watch my video of irregular periods. That was in English, and in Hindi, if you want to watch it, it was periods ka aniyamit hona, that is in Hindi. So in this particular video, I have discussed all the ovulation problems. Mainly the ovulation problems are because of hormones, and hormones also, there are different types, thyroid, prolactin, but the major cause of this is PCOD. And very detailed videos on PCOD have already come. Part 1, Part 2, Part 3, Part 4. Long back they came, and I got a tremendous response because I have covered each and every part of PCOD, practical and theoretical. So you have to go through those videos. So in PCOD, what happens? The egg does not mature. There are multiple eggs in the ovary, like a necklace. Or sometimes if it matures, it does not get released. That is because the wall of the ovary is very thick ovarian stroma. Many patients, they ask me, what is ovarian drilling? The ovarian drilling is the treatment for PCOD for patients who are resistant to medicines. It is done laparoscopically with a keyhole surgery, very small procedure, 15-20 minutes. We use a pen-like cautery machine, and it is inserted inside the abdomen, and we just make multiple holes on the ovary wall so that the wall is weakened, and we assume that for the next 1 year the patient will start ovulating because we have weakened the wall. The wall is weakened because of multiple holes, the egg easily gets released. That is why we advise you to plan your pregnancy within 1 year of a surgery, because that is the best time. Because the results of surgery, they stay for 1 year. After that, again, the other things, the ovarian stroma starts thickening, because it is something which cannot be changed or treated completely. It will stay there with you, right? So try and conceive. Do not delay your pregnancy once you've had the surgery. Ovarian drilling is basically making multiple holes in the ovarian stroma. So in PCOD, because the ovum is not maturing, or even if it is maturing, it is not getting released, that is why the pregnancy is not possible. Now, if you have irregular periods, if your cycles are less than 28 days, then obviously you are ovulating earlier than 14th day. Normally it is 14th day, as I told you before. 14 days and 14 days, so that's a 28-day cycle. In the middle, the ovulation occurs. So if it is a short cycle, the ovulation will shift earlier. If it is a longer cycle, the ovulation from 14th day, it will go in it will go ahead. So basically, if it is a long cycle, the ovulation will get delayed. If it is a short cycle, the ovulation will be earlier, right? So that is, it's very difficult to detect. I have already told you in the part 1 of this video how to make out that you are ovulating. Now, what treatment do we give for ovulation? There are multiple drugs available in the market: clomiphene, letrozole, human menopausal gonadotropins. These are the injections. So the doctor has to stepwise think and titrate your dose depending upon what kind of a patient you are, what is your body structure, and what medicine suits you. And we have to titrate the doses. We have to see that the doses are increased every month depending upon your sonography findings. We do a follicular monitoring on you to check whether the eggs are getting produced and they are of optimum size or not. So the dose of clomiphene starts from 50, it can go up to 150 to 200 to 250 as well. Letrozole doses starts from 2.5 and it can go up to 5 or 7.5 maximum. HMG, that is human menopausal gonadotropins, they start with 75 and then we can go up to 200, 250. So that is a very high dose. So generally, what are the side effects of these drugs? Well, generally the injections, they cause you a lot of water retention, so you tend to gain weight. You feel very uneasy sometimes. You might end up in a very lethal, I would say, a condition which is kind of life-threatening, which is called OHSS, ovarian hyperstimulation syndrome. Now this happens when you get a lot of drugs which are stimulating your ovaries to produce eggs, and suddenly the ovaries go bizarre. They develop so many eggs that you would retain water everywhere in your lungs and your tummy. You become ascitic, you kind of swell up with fluid. Generally it subsides on its own. You just need some hospitalization, you need high protein diet, and you need less of fluids. Generally it goes away, but sometimes if you are not present at the right place at the right time, say if you're not able to go to the hospital and you ignore your symptoms, sometimes you can end up in trouble. right? Because it can be life-threatening sometimes. So these are the side effects and the depression which comes with these drugs. Because you are doing a timed intercourse, your doctor is telling you, okay, now for the next 7 to 10 days you have to stay with your partner. Every now and then you're coming to the hospital for sonography. Every now and then you're getting asked by the parents, by the in-laws, there's peer pressure, the neighbors, why are you going to the hospital again and again, you're not able to conceive. So this is something which I think is happening with many of the couples. Many of the couples, they get disheartened. Ma'am, everything was normal. I ovulated. The sonography said that I have ovulated. I stayed with my husband for 10 days, regular intercourse, still I did not conceive. Now there is no answer to that. It is very difficult to detect what is happening inside the body, because we doctors, we give you medicine so that the eggs are produced and we monitor you and we are happy that we have done our job, the egg is ruptured, and then we ask you to go and have intercourse. But then if you do not conceive, we do not have an answer for that. Right? So every time when you come, we try to increase the dose. In case the dose is optimal and you're producing good number of eggs, then we do not increase the dose. We just increase the, we just ask you to come again. In my practical experience, in the 20 years of my practice, what I have seen is that if a couple is coming regularly for 2-3 months and I'm giving them medicine, they are going for a follicular monitoring, everything is normal, still not able to conceive, that's unexplained infertility, I tell them to go and wait for 3 months. 2-3 months, do not come to the hospital, just relax, take a break, just live like a normal husband-wife, do intercourse according to your choice and just forget about the medicines, because that particular pressure, it decreases your egg quality, your mental depression and all. So sometimes, in fact many times I've seen that when patients take a break, because either I tell them to do that or sometimes they take a break on their own because they get fed up coming to the hospital, such patients, they come back with a pregnancy. And this is a fact. This happens because we give you medicines, so many medicines, that your entire hormone cycle and the machinery inside the ovary which produces eggs, that kind of speeds up. So as soon as you stop medicine, your stress level is reduced. You know that you don't have to go to the hospital, there's no expenditure this time, you're not spending on medicines, then you conceive. And this is something tried and tested in the last 20 years. So I do that, this is my practice. Now the other option for the doctors, when patients are ovulating and they are not conceiving even after giving them proper medicines and regular intercourse, then the next step is IUI, that is intrauterine insemination. And the next step after that is IVF, that's in vitro fertilization. Well, that I will be discussing in the next videos, IUI and IVF, what is the difference. IUI is basically just injecting the semen of the partner inside the uterus without any operation. IVF is tedious and many patients now know it because it's very famous now. So I'll be making a separate video on that. So I think basically this is all you need to know about ovulation. We have discussed everything in short and the detailed videos have already come about ovulation problems and all. So this is all you need to know, what all the doctors do, what all you should expect from the doctors when you're undergoing ovulation induction. So if you like the video, please share it, subscribe it and click the button on the bell so that you get the notification, and keep waiting for my next video. Thank you very much. Take care.